It's quite dark, it's quite late, so I've just come down to check on the little fella, see how he's doing. Hello, little man. Hello, little man. You seem happy enough, although you've managed to pull your hay net off. But your water's still standing. You seem relaxed enough. Hey, hey, little man. It's just getting used to life here, isn't it? And you're a good boy. He's nice and relaxed right now. He's none the worse for his experiences this morning, other than a little minor cut on the inside of his back leg here. So actually he arrived with this little graze on his leg anyway, but in his escape from the stable he's just opened it up again, but it's very minor. He's only taken off a little bit of skin, so I'm sure he'll be feeling a little bruised from that, but he's likely to be staying in for a few days after he's had his hot medicated anyway.
So here we have Nero. It's just about to load, and it's made it slightly more challenging today due to the weather conditions. It's rather wet and windy, but he has habits of loading practice the last few days, and it runs. Oh, look at that! I didn't want to speak too soon, but he walks straight on like an absolute gent. So good on little Nero. So we'll get him shut in the box now, and then next to walk on will be old man babysitter Hidda Hops. So Nero, we could have travelled him on his own, but we just thought, for the sake of ease and keeping him happy, we'll travel him with a companion. Furthermore, Hidda needs some sarcoids looking at, so he's just being a little pushy there with Tracy. So I will get the partition across now. Apologies for the camera angle here. Yes. So I'm just shooting it across quite slowly, just giving him a minute to process what's happening. Sorry, lad. So you can see in his face, there's a little bit of apprehension there at the moment, a little bit of bullshiness because he's a little nervous. But once we've got Hidda on and we're on the road, all nerves will have settled. So here's Jody holding on to Hidda, the Hidda holder. Are you having fun in the woods? Yay! Yay! And there's Tracy preparing for loading number 2. Ah! I just nearly got a bum in my face. Thanks, Hidda. Yep. Cool. So here's Hidda now. It's been a little while since he's gone on the lorry, but he has been well travelled over the years, so very just crack on. The only thing is, I think sometimes with the older ones, it's having the strength to push themselves up the ramp still, because they know how to do it. It's just got strength in the hindquarters. As you can see, the rain is rather prevailing today, which isn't going to be helpful. So Tracy's going to take him now. There we go. And on he goes. Excellent. So now we're all ready for our onward journey to Penrith. Well, we're leaving you to get wet. Apologies.
We've arrived up at Frames, up in Penrith. We're a little bit early. I'd rather be early than late. And you can see Nero is quite happy and relaxed. And he's got little Hidda at the back there, keeping him company. So he's had a hay net. He's eaten through that. Hey. And we'll get him unloaded shortly.
So we're in the x-ray room now. We're just about to leave actually, because we're not allowed to see the actual x-ray taking place, but Nero's just been sedated, so he's a little bit sleepy. So we're just gonna leave him to it in a second and leave him in Sam and Judy's capable hands. And then over here we have Hidda, who is in the stable, which he's not too happy about at the moment, but I'm sure he'll settle in a little while. Because it's been a while since you've been here, hasn't it, Hiddy? Yes.
These two views are the same of the right hind, which is at the one he's lame on. This is the left hind. So you've got nice 4 joint spaces, 1, 2, 3, 4. The lower 3 hardly move at all. There's very, very minor movement. The 4th joint is where nearly all of the flexion of the hock comes from. But these are the ones where you often get hock arthritis, and this is what you should see. So nice sort of well-defined joint space. Whereas look on this one, the joint space has got, well, to be fair, actually on that view you can see it a bit. On that view, the joint space is almost obliterated, and on that one you can see this joint space is nice and clean, and that one's pretty well defined. But the middle one, so which is actually called the distal intertarsal joint, so the lower of the joints within the hock itself, is very, very badly diseased.
What's this bit here? Is that all the signs of the arthritis?
Yeah, it's arthritic change. I mean, instead of having a nice sort of, it's a different view, but essentially you should have a nice smooth black line like that, which is where the joint space is, and you can see it on this edge of the joint. But here, the darker grey area, so this blackness, is where bone and cartilage is being reabsorbed and then laid down again, and so more X-ray is going through it. Ideally, you just get the X-ray going through the joint space, or rather, the X-ray would only penetrate the joint space because the rest of it gets absorbed by bone, and that's what the black line is, where the X-ray's gone through. Whereas here, you can see that there's blackness within the bone as well, which means that that bone is less dense because it's sort of what we call sort of remodeling or changing, or technically you should call it modelling rather than remodelling.
So would it be worth taking another one from this angle today to see whether it's changed within a couple of months? Or would you do that?
No, we could do it now. I mean, it's probably not going to change what we do, right? Because that joint is, well, it's pretty much beyond. You never get it. There's nothing you're going to do to get that back to anything approaching normal. But I mean, as I was saying last week, I mean, probably the best bet for it is for it to try and fuse. And if you, well, particularly look at that view there, well, it's a bit blurred, this picture, but I mean, you can hardly see a joint space.
Okay, so what you were saying before about it's very difficult to inject into this area here.
It's more difficult to inject into this joint than this one.
Okay.
Simply because of access. You have to inject it from the inside aspect of the hock, and it's a very small opening into the joint. Whereas this joint is actually fairly straightforward to inject it, to medicate into, and that's what I'd normally do, because by no means all, but some joints directly communicate, and if they don't, then you'll sometimes also get diffusion of the medication from this joint into that one. Having said that, the principle behind medicating this joint in early arthritis is just reducing the level of inflammation, and therefore, reducing the pain levels. The arthritis is so advanced in this joint, I wouldn't be surprised if it didn't work. But it's worth the go, because you don't know until you try it. It's not going to do any harm.
So today you'll inject into this one then?
And even with sort of stem cell treatment, it's sort of gone beyond the point where it's going to be repaired, because there are stem cell treatments where you can inject in, and the principle of it is hopefully that the cartilage repairs rather than you just getting rid of the inflammation as you do with corticosteroids. But I mean, I would imagine there's no way stem cells are going to get anywhere near to repairing that, because it's just too far gone.
No, I suppose we just need to do that injection today and then see in a week's time how comfortable he is.
That would be my inclination, I think. Yeah,
okay.
And it's sort of, well, it'll hopefully make him more comfortable, and if it doesn't, well,
we'll cross that bridge when we come to it.
If it doesn't, it's either because it's not going to work, or because potentially it hasn't reached this joint, and then there's things you can do to sort of localise it further, but I think that's probably what I'll do to start with.
Yeah.
Yeah.
Okay.
So what are we doing now, Tracy?
So now Sam is going to inject his hock.
Yep.
In the hope that it's going to travel through the bottom affected joint up to the middle one, which is the worst affected. It will take about a week to kick in.
Okay.
So we'll know in a week's time whether he's more comfortable.
So after this then, do we literally just wait for the sedation to wear off more and then take him home?
Yeah, by the time we've seen Hida, then the sedation will be
so we'll have the injection and then we'll take him home, and then in a week's time we'll see if there's any improvement and we'll go from there. Yeah. Excellent. He looks like he's
beginning to wake up, so we might have to have a little bit more sedation.
And out here, bless him, is Hida. And because Hida's an older boy and he's been to the vets a few times before, and he's suffered with sarcoids many times over the years, it might not necessarily hold. Sometimes the vet can be quite an anxious environment for the horses because they know why they're here, and they're sometimes anxious for the treatment. But Hida, he's having non-invasive treatment today. All he's having is some sarcoids looked at. So hang in there, little kitty. It's all okay, my gorgeous. It's all okay. I'm just preparing the area to make it nice and clean.
Fancy name is methylprednisolone acetate, and the trade name is depomedrone, and it's just a long-acting corticosteroid.
So in layman's terms, it's a steroid anti-inflammatory.
Steroids are very potent anti-inflammatories, so yeah, it's just a very potent anti-inflammatory. Okay. And the principle being just to get rid of any inflammation within the joint. But as I was saying before, the joint that's affected is so severely affected that it may well be that just the anti-inflammatory effect won't be enough to completely get rid of the pain, but we'll just have to wait and see.
Yeah. Good one.
See the joint fluid just building up in the hub of the needle there. It just goes in with no resistance. That's that. Right.
So in terms of what we do with him immediately now, obviously take him home.
About a week or so of either box or fairly confined rest. He wants to have at least a week or so of not being charging across the field.
So if he goes in the stable and then in the little turnouts.
That's fine. Yeah, it's small turnout. It's just that you've got to give the drugs of every chance of having its anti-inflammatory effect, and if he's hooning around the field, he's going to carry on aggravating the joint. And so you want to be able to say he's had the injection, he's had some rest. Yes, it's worked, or no, it hasn't.
Okay, yeah. All right, perfect. Just need you to wake up a little bit now. Go on, I'm going to get you on camera. Go on, guess his weight.
5'15".
5'15". Really? So we're going to just see what he weighs.
Oh, keep going.
Pretty close there. Well, at least we know what he is now.
Should we follow them on with the next one, just as a comparison?
He'll be substantially more. He's older, he's allowed to be a little bit tubby.
So we're now weighing Hida, who is a little bit on the tubby side, but he is an old man, so he's allowed to be.
I'll go around the side again so we can see it.
Okay. weather.
Yeah,
We
but he
haven't.
looks well for it, doesn't he? We're back. It was rather windy, but he's had his hock medicated. He's going to spend the next week just in here and in the turnouts. There's Holster coming back up the road. Was Hidda happy to go back out?
He was, yeah. We're trotting off.
Oh, we were worried that he'd want a night in after his little trip out, but
Yeah, but at the end of the day, he's had 2 nights in
yeah,
on the trot, and I think when he hasn't been out for a bit, he does miss his girls.
he does.
And he worries about them, you know.
Yeah. But anyway, Nero is here in a stable that he can't tonight. Well, hopefully he won't jump out of or try and clamber out of. Still a little bit sleepy. Send all the positive vibes, keep your fingers crossed, send him best wishes, and let's hope that this medication does the trick and makes him more comfortable. Here's Angel Eyes in the turnout with new boy Nero. He's had a couple of nights in now since he went to the vets, and he's actually very quiet at the moment, so I think the adrenaline that they get when they go to a new location makes them quite full of themselves, and I think now he's beginning to settle. He's probably a little bit drained after everything that's gone on over the last couple of weeks, so he's quite quiet, but he's fine. He looks happy enough in his eyes, and I would say yesterday he didn't walk out of the stable looking any sounder, but this morning I'm pleased to say that he actually looked, and I hope it's not wishful thinking, fractionally sounder, so I'm hopeful that we're on the right track with him. It's interesting that after a few days of being very, very subdued and quiet, Nero's come out here this morning full of beans, full of the joy of spring, except it's winter. He's been having a little run and a kick around in here, which again, I hope that means it's a good sign that he's feeling so much better. That's Frey just giving him his haylage in the hay bar for the day. So he's obviously, with his weight, he's getting ad lib food. So plenty of haylage and 3 hard feeds a day. But we'll bring someone in and give him a buddy in there, which will keep him happy as well. Nero's not actually met Hoytzer yet. I'm quite interested to see how they get on, because Hoytzer is a very, very dominant character that doesn't get on with Hidda because he's an equally dominant character, but Hidda's accepted Nero really well, and if Hoytzer isn't going to accept somebody, he would immediately turn round and try and kick out. So this is really interesting, that even he appears to be accepting him very well. So that's fine, you know, he lifted a knee, and if he was going to be aggressive towards him, by now he would have tried to spin round and kick out. So because of Hoytzer's character, I wouldn't put him in this little small space with him, because Hoytzer does like his own personal space, but certainly that bodes well for him potentially going in the field with him one day. The frustration is setting in a little bit now with Nero being in a confined space. So he's been having a good dance around in this little area. But as I've said before, we're keeping him restricted for a full week after his injection, just to give him the very best chance working. Because this young man was getting rather cheeky in the turnout, because he's obviously feeling a lot better, he did almost look like he was going to try and jump out. So for his own safety, I've brought him back in the arena, where at least he's on a flat surface and it's not boggy like it would be out in the field. We've just put little Hidda in with him, because Hidda's the boss and he'll put him in his place if he's being too cheeky. But he's actually ignoring him at the moment. This is where you can't beat a bit of herd discipline. Is it, Hidda? Handsome boy. You are the boss, aren't you? You keep everyone in order. If you don't keep everyone in order, then we'll put Annie out with him. And she'll teach him a little bit of respect and manners. But in terms of his movement, okay, he's got his rug on. I think we're looking good. Terrifying picnic bench over there. Don't dig holes in my arena. That's not helpful. This is where, you know, when horses are confined, you know, you very often hear people saying in the winter their horses are really silly and you know, go crazy and start bucking and leaping around when they try and ride them, but they all need that freedom to stretch and loosen off naturally and let go of that energy. And it doesn't take much, they just need to have a jump and a leap, and it's like them doing their own yoga, and then they soon enough settle down. Hidda says he's too old for it now. The Hidda squeak and the Hidda leg. He's being a little bit wary, which is good. That's very respectful of him. So I'm going to leave these two together for a little while. Hopefully little Nero, now he's got that out of his system, he'll settle down a little bit more and he'll be happier to stay in again tonight. No, he's not quite got it out of his system. But wow, goodness, that right hind leg, he was almost tracking up. What do you think, Little Flops? What do you think? You just steamed up my camera. Handsome. Just going to see if he can play with the flag again now. He's a very curious boy. Putting things into his stable, he always pulls rugs off the side. He's got a busy little mind. sound. That's our leaf blower, which is essential for keeping the yard clean and tidy. He's opted not to play with the flags this time, but to pinch one of the lead ropes. He's certainly a character, I'll give him that.